Hello everyone, welcome back again sa ating channel. Again, my name is Sir Joel, and this is still part of the third phase of the nursing process, which is still a continuation of the video series that I am doing about nursing process. If you want to check the first videos of the nursing process, plus the first part of these video about planning phase, kindly check the description box below, and don't forget to subscribe in this channel. Please hit like, comment, and share this video na rin po sa inyong mga kilalang nursing and nurses and nursing students. Okay? So just to give you a review of the first part of the planning phase that we already uploaded online, or here in YouTube, or here in our channel, okay, there are 4 activities that we are actually doing in your planning process. Number 1 is selecting the priority nursing diagnosis, followed by creating now your goals and objectives, or the goals and desired outcome based on the prioritized nursing problem. Okay, so the third part now is selecting the nursing interventions and activities, which is still part of your planning phase. Okay, let me continue with this video. Again, don't forget to subscribe to our channel. Okay, so for the selection of the nursing interventions and activities, this will still be based on the created nursing goals or desired outcomes that we have, okay, which is based on the nursing diagnosis, and the nursing diagnosis is based on the assessed data, okay, from the patient. So in selecting nursing diagnosis and activities, we have to consider that nursing interventions and activities are actions that the nurse performs to achieve the client goals. Okay, so these are the actions that the nurse performs to achieve, okay, to achieve the client's goal. Kaya nga po ito naka-base doon sa second process of, or the second activities under your planning process, which is the creation of your goals and desired outcomes. Now, the focus of our nursing intervention, the focus of nursing intervention is basically to, okay, reduce and eliminate, okay, reduce or eliminate, okay, reduce or eliminate the etiology of the problem. And when we talk about the etiology, that is the cause or the etiologic factors na tinatawag, or the factors that can contribute to the development of the problem. So basically, the focus of our nursing intervention is to remove, or to at least reduce this etiology. So reduce the cause or the factors. And take note that when it is not possible to eliminate or reduce the etiologic factors, the nurse chooses interventions to treat the signs and symptoms. There are instances that the identified nursing problem is something that we cannot resolve as a nurse. Therefore, we will manage, okay, or provide nursing interventions symptomatically, okay, or yung tinatawag natin based on the signs and symptoms presented by the patient. Like for example, if the cause or the etiology of the problem is more on the disease process, wherein it needs some pharmacologic treatment and other interventions that only a physician can order, okay, we will only the focus of our interventions will to treat the manifestations or the signs and symptoms, okay, or the signs and symptoms. And that can happen, okay, that can happen sometimes, especially if the patient's condition is more critical than what it is expected, based on the responsibility that a nurse can actually take over in terms of providing nursing interventions. Now, okay, there are several types of nursing interventions that we can use in order to for our NCP to become more effective. Okay, number 1 is we have to consider adding independent interventions. When I talk about independent interventions, guys, independent from the word independent, so it is referring now to the nurse responsibility. Okay, nurse responsibility, the nurse responsibilities. So these are interventions that a nurse alone can perform, even without the order from the doctor, or even without help from other healthcare professionals. So like for example, if a patient is having fever, okay, one of our independent nursing interventions is to loosen clothing, okay, bawasan ang kanyang suot. We can advise or enforce force fluid, taasan or damihan niyang pag-inom ng tubig. We can also do your TSB, okay, or your tepid sponge bath, okay, tepid sponge bath to decrease the client's temperature, okay, if the patient or if the client is actually hyperthermic, okay, o nilalagnat. So that is independent interventions, independent nursing interventions. Again, these are interventions that a nurse can perform even without doctor's order. We also have your dependent interventions. Ito naman yung kabaliktaran ng independent interventions, wherein dependent interventions requires order. Okay, requires order or prescription. Okay, prescription. Okay, requires order or prescription. These are things that we cannot perform, or that is not part of our responsibility as a nurse. Okay, so it requires an order from a physician or other healthcare provider concerning the condition, okay, before we can actually perform it, or before we can perform it. For example, giving of antibiotics. Yeah. Okay, giving antibiotics. Okay, before, okay, antibiotics, you can take antibiotics without prescription. Okay, that was before. However, due to the recent development about the use of antibiotics, wherein a lot of people is actually developing yung tinatawag nating antibiotic resistance because of the incorrect use of antibiotic. Okay, wherein pag sinabing 7 days dapat i-take, after 3 days, naubos na or wala na siyang symptoms, ini-stop niya na mag-take ng antibiotics. Then, re-reoccur po yung infection. So, the patient may develop yung tinatawag nating antibiotic resistance. Okay? Kaya ngayon po, we cannot give and a person cannot buy or even buy antibiotics without any prescription. So, that's why that is an example of a dependent nursing intervention. The third one is collaborative nursing intervention. When I talk about collaborative nursing intervention, the root word is collaborate. It means to say that we are working with other professionals, okay? Working with other professionals, okay? Working with other professionals. So let me go back to the previous slides. Working with other professionals. For example, we will be working with a physical therapy for the patient's rehabilitative aspects in terms of its motor function. We will be working with respiratory therapies, okay, para sa kanyang respiratory functions. We will be working with doctors doctors if they need to perform a certain procedure that requires assistance from nurses. Okay, so collaborative interventions are any interventions that we are working with other. Okay, that we are working with that other. Baka malito po kayo. There is the difference between dependent and collaborative. Dependent is more on it requires an order, while collaborative is something that we need to do together with the person or other healthcare provider. Okay, with other healthcare providers. So that is your collaborative, dependent, and independent nursing interventions as types of nursing interventions. Okay, interventions. Let me proceed. Now, the consequences of nursing interventions. What is the effect? Okay, what are the possible effect of nursing interventions once we implement this to our patient? These are the possible nursing interventions, but are not limited to. Okay, number one, it may increase or decrease anxiety of the patient depending on what do you want to achieve. Okay, it may also if you wish to talk with the primary care provider, okay, you may gain cooperation. Okay, you may gain cooperation. It may promote relaxation. Okay, relaxation and so on. So marami po yun. Okay, so those are just few examples on the possible effect of nursing interventions. So these are the criteria for choosing a nursing interventions. Not all available nursing interventions out there is applicable to our patient. Okay, so we have to choose a certain interventions that is most applicable to the patient's condition, and these are the criteria that we need to consider. Number one, it has to be safe and appropriate. Okay, it has to be safe and appropriate. Of course, when you say safe and appropriate, it has to be a product of evidence based practice. Okay? It has to be a product of evidence-based practice. Ibig sabihin, that is based on research. Okay? Napatunayan na safe and effective. Another one, it has to be achievable with the resources available. Of course, okay? Achievable with the resources available. We will not include interventions that is not applicable and it is that is impossible for us to accomplish. Okay? It has to be achievable with resources available. Kaya nga doon sa ating goal setting, kasama doon yung tinatawag na SMART. SMART, it has to be simple, specific, measurable, and attainable. Okay? Attainable. So the interventions that we'll be providing or we'll be using should be achievable or attainable with regards to resources availability as well. Okay, congruent with the client's values, beliefs, and culture. Remember, with our previous, if you did watch our last video, okay, one of the factors that can affect, okay, that can affect the setting or the prioritization is actually the client's values, beliefs, and culture. So whenever you set or include nursing interventions in the client's care, you have to consider the client's values, beliefs, and attitudes. I believe the example that I have given is actually the blood transfusion, which is in relation to one religious group wherein they didn't believe in the practice of receiving blood or blood products from other person. Okay, so it has to be congruent. Ibig sabihin, it's acceptable, okay, acceptable with the client. It has to be acceptable with the client. Next, congruent with other therapies, okay? Make sure that the interventions that you will be giving is not in contrast with the other interventions that other healthcare professionals is giving, okay? Congruent with other therapies. Based on nursing knowledge and experience, again, it has to be evidence-based, okay? Evidence-based interventions, evidence-based, based on research, okay? And with established standards of care as determined by state laws, professional organizations, accrediting organizations, and policies of the institutions, okay? Very good example lang po nito, like for example, TSB. Okay, TSB in the old days, kailangan with alcohol. Okay, with alcohol. Kaso nga lang, napatunayan na when you put alcohol sa tubig, it will promote dryness sa skin ng pasyente. Kaya ngayon, with the new practice, we are no longer adding alcohol doon sa tubig na pinagbabanlawan natin noong bimpo that will be used for the TSB or the tepid sponge bath because of this reason that another research proved that it will do more harm than good. Okay, kaya hindi na po nilalagyan ng alcohol yung ating tubig. Okay, yung ating tubig. So that is the criteria for choosing a nursing interventions. Okay, we will now go to the last part of the activities or the last activities under your planning process, which is writing the individualized care plan. So, in writing the individualized care plan, you have to date the nursing interventions on the care plan when they are written and review regularly at intervals that depends on the individual's needs. Of course, this care plan will also serve as a communication or as a way of communicating with the other colleagues or other healthcare provider that is part of the healthcare team. Another one, the format is similar to that outcomes. It has to have a verb, conditions, and modifiers plus a time element. Okay, and you have to write interventions precisely. You have to write interventions precisely. Okay, so I have an example here. Okay, the correct ways of writing a nursing intervention. Some of us are already fond of using of these intervention, or fond of using these phrases or sentences in writing our interventions, but I'm going to show you the best way on how to write it. Like for example, here are correct statements or phrases, okay, on how to write a nursing interventions. Teach about insulin, okay, or teach about insulin administration, okay. Assess edema on the left ankle daily, okay. Another one, apply spiral bandage to left leg. So these are correct ways on writing a nursing interventions, but there is a better way, okay. Instead of writing teach about insulin, write explain the actions of insulin, okay. Explain the action of insulin. So instead of using teach, you write there explain, okay. So much better na po yun according to Fundamentals of Nursing by Cozier and Earps. Instead of writing assess edema on the left ankle, okay, it is better to write measure and record ankle circumference daily at 9 a.m. So sabi nga natin kanina, you will write it precisely like yung ating outcomes. Okay, nandiyon yung so of course you will going to measure the client's ankle circumference daily at 9 a.m. So we have the subject, which the client, measure and record would be the verb, okay. Measure and record will be the verb. This is your criterion, and this is your modifier, okay. So that is your better way of writing. Instead of writing interventions na assess edema on the left ankle, you write it more specific, okay, in terms of writing a nursing intervention. Instead of just assessing, you write there measure and record. So you write yung actual activity na gagawin mo, okay. And apply nurse a spiral bandage to the left leg, or apply bandage firmly. Kailangan may modifier tayo. Okay, firmly to left lower leg. Hindi lang left leg, okay? So, left lower leg. So, may modifier tayo. So, firmly. So, that's the modifier, and we have your criterion. Criterion and your modifier. Okay? So, that's how you're going to write your nursing interventions. Okay, again, the correct part or the correct column here are actually can also be used. However, it is better if you're going to write it more precisely and more specific. Okay, and so what is now the relationship of nursing interventions to problems? Again, nursing interventions are the action of the nurse that will address now the prioritized problem, okay, the prioritized problem. And these nursing interventions will going to answer the goals, okay, that was set, okay, by you and together with the patient. So observation, preventive intervention, treatments, and enhance and promotion interventions. So in terms of the nursing, in terms of the relationship of the interventions to the problem, okay, we have to take note that we have to include nursing interventions that will assess, okay, that will assess, okay, that will assess the presence of the problem, prevent the recurrence of the problem, that will cure or manage the condition, and of course that will promote the client's overall health status, okay, overall health status, okay. So that is the relationship of nursing interventions to the problems or nursing problems, okay. Now the nursing interventions classification, just like the first two phases, the nursing diagnosis and your planning phase, is a base sa mga international or standardized books that was actually created by nursing leaders and researchers. Same thing with nursing interventions. Okay, nursing interventions classifications, including its taxonomy interventions, which is developed by Iowa Interventions Project, and it is updated every 4 years. That is consists of 3 domain levels. So this is another book like Nanda, but it is more on the nursing interventions Okay, nursing interventions that will address a specific nursing conditions. Okay, so interrelated po yan. So that is your planning phase. Again, to give a summary of the nursing phase, because this is our last slide. Okay, the nursing process, third phase is your planning phase. The planning phase is consists of four activities. Number one is setting criteria. Second one is creating now your desired goal or outcomes. Then your nursing interventions, selecting your nursing interventions, and the last one is the development of your nursing care plan. So priority setting is based on the identified problem, okay, during your assessment and nursing diagnosis. And during the nursing diagnosis, you'll be able to come up more than one nursing problem, and you have to prioritize that based on different approach, such as your ABC approach and your Maslow's hierarchy. So you have to check kung ano yung pinaka-priority na problem, and that's the nursing problem that you will be creating an NCP. Okay, and based on that created nursing diagnosis, we are going to set the goals, and the goal has to have the four component, which is the verb, the subject, the modifiers, and the criterion. Okay, and it has to be measurable and more specific. It has to have the SMART principle: specific, measurable, attainable, realistic, and time bound. Okay, and for nursing interventions, this is more on the actions that will do or that will be performed by the nurse. So it is better if you're going to to describe what are you going to do and not just simply tell what are you going to do. Okay? That is your nursing interventions. Of course, sa mga susunod na videos natin, we will be creating an example of your NCP. Okay, we'll be creating a video about that after the video series of the nursing process. So the first three phases are already done. We're down with two remaining phases, and those phases are it's actually small discussions lang, little discussions. So hopefully within this week we'll be able to upload already the example video of NCP on how to create your NCP itself. So example na po talaga tayo. Okay, so I hope you have learned something today, and don't forget to subscribe, hit the like button, share this video, and of course comment na rin po for future topics that you want me to discuss. Thank you once again, and bye for now.